everyone. Thank you so much for joining us this evening for the Black Resilience Roundtable, advancing a racial justice response agenda for COVID-19 in Illinois. My name is Joy Mobio. I am the political director for the Workers Center for Racial Justice, a grassroots Black liberation organization based on the South Side of Chicago. I would like to thank our co-host, Rep. Kam Buckner, first and foremost, who has continued to work with us throughout this roundtable. I would also like to acknowledge additional legislators who have joined us today. Rep. Camille Lilly, Rep. Lamont Robinson, Rep. Maurice West, Rep. Thaddeus Jones, Senator Maddie Hunter, and Senator Robert Peters. Lastly, but not least, I would like to acknowledge that the Workers Center for Racial Justice members and leaders across the state here are here to give our perspective during this time. As many of us know, the coronavirus has hit us hard. From death rates to unemployment rates, there is not a single issue that does not hit Black families disproportionately. This is not surprising. The historical racism built into this system has intensified the abiding structural barriers to financial opportunity that Black workers and businesses owners in Illinois have endured for generations. In order to counter the destructive racialized toll that COVID-19 pandemic will have on the health and economic stability of Black communities across Illinois, the Workers Center for Racial Justice has put forth an assertive COVID-19 response plan that addresses the most urgent policy priorities of Black Illinoisans amidst this public health and economic crisis. I would like to go ahead and introduce our facilitator for the evening, Antonio Lightfoot. Since 2014, Antonio has been organizing and disinvested Black neighborhoods in his hometown of Chicago. As lead organizer at the Workers Center for Racial Justice and the Center for Racial and Gender Equity since 2007, Antonio mobilizes community members around issues that he is most passionate about, including Black equality, police accountability, and reinvestment for the formerly incarcerated community in Chicago and across Illinois. Please join me in welcoming Antonio.
Thank you. Thanks, Joy. I appreciate that. Again, I want to thank everybody for joining this important dialogue. It is very much needed. We have, on this panel, we have both legislators and community members from around Illinois and Chicago to give their perspective on what needs to be done and what should be done about the coronavirus effect. We feel like this is always a viewpoint, the people's viewpoint that is missed in every environmental disaster. So we want to make sure we bring the issues from the people to the legislators. So thank y'all for joining us. So I would like to introduce our co-host for the evening, Representative Kam Buckner. Representative Buckner is a native of the South Side of Chicago and the fourth child of a Chicago public school teacher and a law enforcement officer. He represents the 26th district in the Illinois House of Representatives. The district includes Kenwood, Bronxville, South Loop, downtown, River North, Streeterville, and the Gold Coast. He has a lot to say about this topic and has been very instrumental since everything started. Please join us in welcoming Representative Kam Buckner.
Thank you, Antonio, and thank you to the Workers Center for Racial Justice and everybody that's joined the call. Special thanks to my colleagues from both the House and the Senate who are here today to listen to the things that are of import to the community. The reason this was important to me to try to help bring this group together is because while we're in the midst of this crisis, there are a lot of things that we're responding to in a reactionary way. But we know that at some point we have to move forward with actual policy, right? And to be proactive to try to alleviate some of the ills that exist in our society. It was just a few weeks ago that we first heard the numbers that in the city of Chicago, 70% of the COVID decedents were African American, when We know that African Americans only make up about 29% of the city's population. And so those numbers really highlighted the systemic inequities and inequalities in our society. It's woven into our experiences, and this is what we want to get at on this conversation today. We understand that there also is a huge plight for the folks in our community who are essential low-wage workers, people who are custodial staff, grocery workers, delivery drivers, gas station attendants, line cooks in the restaurants, the folks who we have, I think, often as a society forgotten about as we work and maneuver through this pandemic. I think something that stands out to me is that since the year 1990, China, India, and Indonesia have been able to pull 1 billion people out of poverty. That's billion with a B, in just a 30-year span. This has resulted in a rising life expectancy and creating a new generation of people who have the ability to live healthier, fuller lives. We have not been able to do that in this country, and we see the results of that when we look at the COVID numbers. Chicago has the largest life expectancy gap of any major city in the country. I represent a lot of those communities that really highlight what that gap is, right? So, for instance, the life expectancy in Streeterville is 22 years higher than the life expectancy in Washington Park, which are both neighborhoods that I represent. So we know that the desired standard of living in any community is for folks to be healthy, educated, employed, and safe. What we have seen during the COVID crisis is that our people are not healthy. We're not educated in the right ways. We're not employed gainfully in the right ways, and we're not safe. And so what we have worked to do is to take this crisis and use it as an opportunity to make sure that on the other side of this, we have put the right parameters in place to move our community forward. So I just want to thank, once again, the Workers Center for Racial Justice for helping put this together, for being, I'll say, circumspect and proactive, and knowing that we have to find a way to bring advocacy and turn it into policy and turn policy into change. And so this is really about building a coalition and making sure that all of us are at the table to move us forward. So thank you, guys.
Thank you, Red Buckner. I appreciate that. So next, we're going to go into our discussion. I'm going to introduce a few of our wonderful Workers Center for Racial Justice members to give us a little insight about what's going on in their life and our life around us as a whole. So next up, we have Miranda Alexandria. Miranda is a 30-year-old woman who's part of the gig economy and a rideshare operator. She received her Bachelor of Arts in Political Science from University of Illinois Chicago. She's a dedicated leader with the Workers Center for Racial Justice. She also devotes her time to work on her creative project, Shy AFQ, which is proposed to investigate the narrative of South and West Side community people. Welcome, Miranda.
Hey, everybody. So just to give you guys a little bit about my story. Can you guys see me? Okay. So basically, because I'm a rideshare operator, I've seen significant income loss due to this because I'm scared of actually bringing this home to my family. That's number one. And there was a lack of resources, and not only that, lack of information on how to do my job safely and to protect myself from the virus. I mean, the question is, how do you practice social distancing when you're in a car with no barriers? It makes no sense, right? So unfortunately, I did not qualify for the stimulus, nor did I qualify for unemployment, even though the CARES Act was supposed to include gig workers. I was denied, and now that I'm filing an appeal, right? So not gonna lie, the anxiety and stress levels have drastically increased due to the possibility of contracting the virus and not having health insurance. And not only that, bringing it home to my family. Like I said, I live with my mother. I live with a younger cousin. My mother has breathing issues. And not only that, I have a cousin that actually works in a prison who, you know, which we know the virus is running rampant through prisons and jails right now. So all of this is just super scary. And now that I can't work, I can't really afford to pay my bills, to afford my car, to afford my rent, my utilities. Like, everything is like kind of crumbling right now, and it's very scary, especially with the uncertainty of everything.
Thanks, Miranda. I appreciate that perspective. Next, I am going to introduce Denzel. Denzel Johnson is a 22-year-old Chicago native from Auburn Gresham. He has a bachelor's in communication studies from Monmouth College. He's been a strong advocate for change on issues like immigration, interfaith leadership, and prison reform. Now he's fighting for Black liberation. Currently, due to the pandemic, he's struggling to find employment, and bills are piling up, and is yet to receive unemployment benefits or SNAP. He's one of the folks who have been truly left behind. So we are very glad to have Denzel on this panel today. Welcome, Denzel.
Hi, thank you very much for the introduction, and thank you for all those that are listening. I am a very passionate social justice activist that believes in his fight for his fellow man. As you heard, I'm a recent graduate from Monmouth College, and now that I'm back in the sweet home, Chicago, I have been struggling to find employment, but I have changed my focus and my attention to the U.S. Census to ensure that everyone is being counted, especially in hard-to-count areas. Been doing that through social media postings, flyer distributions, and organization, community organizing, while also working with the Workers Center for Racial Justice. Right now, if someone would have told me that this was going to happen in 2019, I promise you, I solemnly swear, I would not have thought that this would have been going on. But as someone who is a regular citizen, I think that's something that's okay. But I feel like there should have been a kind of something in place. Because right now in my eyes, I feel like this pandemic is really just revealing underlying issues that has always kind of been in place, as a lot of people have said earlier. I worked at Burlington Coat Factory before I was unemployed due to it being a non-essential business. And I feel that not only has that affected me, and I'm not the only one that is experiencing this, and I'm not struggling alone. And I just wanted to make sure that I am standing up and representing those who are experiencing the same things that I am. And I feel like the reason why this is happening is because most people that are unrepresented are working in industries where they're overrepresented and have been affected and been really crippled by the social distancing mandates and the stay-at-home orders. So I really just wanted to end my story off by saying that I stand with those that are constantly being put on the back burner. I represent them. I stand with those who are suffering losses, whether that is due to someone passing away due to this virus, whether that's loss or unemployment, and especially those incarcerated men and women who are, as was said earlier by Miranda, that are in close quarters, close together, in undersupplied resources, have underlying health risks, but are also still being forced to work in these private-owned prisons. And last but not least, I would like to stand with those on the front lines where in companies like Walmart and Target and other companies where they are forcing them to buy the supplies for, like the mask I have on my face, the gloves, and are not giving them all the necessities that they need, but are also receiving the revenue due to the conveniency of their store or their brand. And also, thank you for allowing me to be a part of this conversation. Thank you so much.
No doubt, I appreciate your input, Denzel. We all do. Next, I want to bring up Jermon Montgomery. Jermon is one of the founding board members of the Workers Center for Racial Justice. I always call him one of the gatekeepers of Inglewood, whether he liked to admit it or not. He was a leader during the strike on the Magnificent Mile and the FOP protests of 2016. As someone who recently recovered from coronavirus, we are very excited to have his perspective today. Welcome, Jermon.
You all do. Thank you for involving me in this conversation. So let me recap my experience. And just before I recap that experience with COVID-19, I'll go back just before COVID-19 was the awareness was put out throughout the country, the shutdown was coming. I became extremely fearful for my family, particularly my mother and my younger brother. My mother is a diabetic and 2-time cancer survivor. My brother is a person that has been, he has sickle cell anemia. And I was extremely concerned that I can lose them during this COVID-19 scare. It just so happened that I became the one that, I guess you could use the word contracted COVID-19. My experience was extremely, that's to say, is a horse of a different color in speaking of the COVID-19 virus. But throughout the entire time I was experiencing COVID-19, which was about 3.5 weeks, and then you can tack on another 2 weeks of recovery, I was extremely concerned about my family. My mother works at UPS, overnight shift, and my brother drives for a company called, Professional Transportation Circle Incorporated, or PTI. And they come in contact with a lot of people and stuff like that. And throughout the entire time, I would say my mother was going to work without PPE, and so was my brother. It wasn't until I was recovered that I managed to go to obtain PPE, particularly face masks and gloves for my mother and brother. So I feel quite fortunate. I was, as far as my employment status at the time, I was just off unemployment. My unemployment benefits ran out, and during the period of time that I was recovering, I get an email from the employment office that I qualified for the unemployment, or the emergency unemployment funds by the federal government. Having said all that, I would say that when we talk about the coronavirus and Black workers, this was a catastrophe for us, or our community and Black workers. I personally feel that it was a attack. It particularly attacked, particularly the breadwinner of families in our community. And I would like to, if I can, I don't know how much time I have in this intro, a young lady bring attention to some people. There was just recently a young lady, a mail carrier, I believe her name was Unique Clay, 31-year-old mother, worked for the post office, was released from the University of Chicago hospital shortly after giving birth, and diagnosed with COVID-19. And that brings off to one of my experience as well. When I first approached my own physician and let them know that I had symptoms of COVID-19, I was treated as if I was delusional, in a sense that I was just, scared having it, and was dismissed. At that time, only hospital employees and people with underlying health conditions could get tested for COVID-19. In the very beginning, if you recall, you needed a doctor's referral to get tested for COVID-19 if you didn't have an underlying health condition. A week later, I became worse, and the statistics came out that the COVID-19 virus disproportionately affected the African American community in Chicago, particularly. And that young lady's story I relate to. Our healthcare system cannot be colorblind as it applies to pandemics or any outspread of a virus. So I'll leave it at that.
Thanks, Jamal. I appreciate that insight. Man, we're glad to have you here. I mean, even more because of that story. Next, we have Crystal Peters, member and leader with the Worker Center for Racial Justice. lifelong resident of Inglewood. Since I've known her, she's always been a fighter for community engagement and criminal justice reform. Welcome, Crystal.
Hi, everybody. I appreciate you all having me. I appreciate everyone that is joining us today. Of course, my name is Crystal Peters, and I'm a member of the Worker Center for Racial Justice. I'm also a mother and a home health aide. I care mostly for the elderly clients which I can't be with as of now because of the COVID affecting them so brutally. They don't want people coming in and out of their homes, and that's their right. I'm also concerned about bringing anything home to my baby. I have an 8-month-old, and my hours have been cut, and it's very difficult for me now financially. Of course, I understand why I can't go to work and everything, but I don't understand why more isn't being done to get money in the hands of average people like myself instead of these big corporations. When it comes to economic solutions, the federal government has missed the boat and they basically failed us. $1,200 or the $1,700, because I have a child, was not enough to catch up on what was missing in March, and it's not enough to catch up, what I'm missing, that the things that are piling up on me. On top of that, my side job that I have, my hustle to supplement my main income, it was lost. And there's no way to really recover that income. With the PPP loan, I didn't have a payroll, so that money didn't come to me. It just wasn't meant for me or people like me. That's why I want to see more things done on the state level, because we can't expect much from the current administration on the federal level, the federal government, guys. Thank you. That's it.
Thanks, Crystal. I appreciate that. And that's a perspective that, most people don't realize, supplemental income. So now we're going to get into a part of it where we'll be going back and forth, asking ourselves questions. Our panelists will be answering these questions. We have more elected officials on this panel, not on the panel. We have more elected officials in attendance, and you'll be able to direct answers to them as well. But we want this to be very interactive. So type a question. If you have a question to ask, please type it in. We're going to do our best to get to your questions and read them live or answer them via text. We want this to be an opportunity for everybody to have their voices heard. So this question is for all of our panelists that we have on right now. So we are in a weird situation where this is a complete lifestyle change. Like, things are totally different from where they were a year ago. If you can just take maybe, not everybody, but if you choose to, just speak about like what's been helpful during this time, what's been harmful during this time, just to guide us. I know for myself, it's been very challenging, having 3 kids in school age, and now working from home, and also, being a full-time educator. So that's been challenging, but things that I've been doing was implementing Zoom calls with the teachers, doing some YouTube videos and things like that. So how have we been resilient during all of this?
If I was to take a stab at it, I think the challenges of being the primary breadwinner, or used to getting out that door every morning and going to work and providing for your family, and then all of a sudden you're laid off. And that's a dramatic shift for anybody. Now you're not receiving a paycheck. There's been some, I think that we can thank a lot of people that stepped up, those of us that took food to what we call essential workers. those of us that help locate PPE, such those of us that really looked after our elders in the community and stepped up and did homeschooling and made sure that children in our community. So we always been a community, regardless of what many think. The resilience part is that we have to stay engaged, and we have. And we did not let this virus or the incompetence of our government tell us that we could not, take action. I think that we've done a lot to make life as normal as possible. I'm loving some of the engagement on social media. The TikToks has been fun to watch. But all in all, we stay a people that's looking after one another. And I think if that answers your question for me, I think that's something I could say.
Yeah,
Helps us stay resilient.
Okay. Thanks, Jamon. What I'm hearing is like community resilience, and that's really important, and that's why we out here today. So next, we're going to dive deep into some conversations just to get perspective. We have a few major issues that we know affect Black folks more than others. So we want to try to get into the bottom of those solutions and pose some great policy solutions to make things better. But first, it's a fact that Black people have been hit hardest by coronavirus, from our healthcare to our finances to our just our way of life. When it comes to the federal response of COVID-19 and our taxpayer dollars, large populations of disproportionately Black households have been left behind altogether. In your experience, how has the federal response done to meet the needs of you and your family during this pandemic?
I'll answer that. The federal response is not what you would expect it to be. I mean, like I said, I work for I'm a home care aide, a home care health aide, and when the stay-at-home order was in effect and everything, I didn't get a text from my job, which the state pays, and the federal, of course, they get money from the federal government to pay me. We didn't get a text to come get PPE until about a week and a half ago, and I'm thinking like we should have been like the first, along with the other essential workers, meaning in the hospitals and in the nursing homes. Like we are actually going into people's homes, So the way they disperse the PPE and just testing materials, like our other member was saying, it's sickening that, we come last or at all, because who's to say? I don't know who gave my job to this day the PPE that we are to get, and then when we get it, we can't get much of it, so we still have to come out of our pockets. So yeah, that their response is a F for effort.
I like that. Thanks, Crystal. It seems like, we facing an age-old, story about during crisis, who's left behind. It's going to be Black people. It's going to be poor people. The government has been late, late with the stimulus checks, late with the testing facilities, and late with the PPE. So the next question is for Kam Buckner, Representative Buckner. What can you do as a representative to kind of like help with some of those discrepancies?
So I'll say this, and I think that this is helpful as we actually move forward in the conversation as well. I know myself and my colleagues have all been working, around the clock to make sure that we can be responsive to the needs of our communities, right? Sometimes that means going to hand deliver PPE to senior facilities. Sometimes that means finding corporate partners in the district to to team up with to give meals to people. And all that stuff is very important. But as I said in the beginning, and I want to highlight this, that is all kind of reactionary, reactive work. And we've got to do that because we are in the eye of the storm, and we've got to do that in the immediate. But what I think is really important right now is for us to be able to listen to the folks who are on the ground, right? You all. Crystal just told the story about the PPE at her facility or at her employer. And so to be able to take that information and then to mold it into actual policy advocacy, I think is important, right? But way too often in our community, we are not speaking or singing from the same hymn book.
I think Representative Jones want to chime in on this one. Joy, can you unmute Representative Jones, please?
Can you hear me?
Yeah, we hear you.
Okay, that was Trump. Turned off.
Yeah.
Trump turned off my internet. We're all here because we understand that there are problems that are pervasive, right? So I think the question for us is, what can we do to move from where we are currently and to a better spot, right? So what are our solutions? And I think that there are two types of people in this world, right? People who always want to be right, and then people who always want to get it right. And I know about my colleagues on this call, these are folks who want to get it right. So we want to, be able to hear from you guys, what the things are that need to be fixed ASAP, right? How do we take stories like Crystal's and then, like I said, meld them with the advocacy piece that the Workers Center for Racial Justice, is committed to, and so that we know once we get back down to Springfield, whenever that may be, that we have a blueprint and we have a playbook from our people on what's important and what we need to push for to change the situation.
Thank you. I'm glad you brought up blueprint. Because at the Workers Center for Racial Justice, we have released a list of COVID-19 policy demands. They should be not only helpful for all people, but exclusively for Black people, because Black folks are disproportionately affected by this crisis. So I want to talk about some policy solutions. First, economically. When it comes to economics, Black folks are sometimes in harder situations than other folks. At the Workers Center for Racial Justice, we have economic justice demands, including investing emergency and long-term financial assistance for low and middle income households, restoring the basic needs and safety nets for Illinois' most vulnerable, expanding eligibility and funding to the Child Care Assistance Program, directing small business relief to Black-owned enterprises, and increasing state revenue through progressive taxation. So we released these policy demands, but because we know that none of these things are new. The effects of coronavirus, although they're there, they're only highlighting things that were already in place, systematic injustices. So we need to tackle these from a systematic stance. So my next question is about criminal justice reform. The fact that people held in state prisons and are not able to socially distance or receive adequate medical care is leading to elevated rates of coronavirus. What do you think this public health disaster teaches us about the welfare of the prison system?
I think it just goes to show the fact that when it comes to prisons, when it comes to Black folks in prison, the state doesn't tend to care. They lock someone up and they throw away the key. And what we know, and it's both prisons and jails to me, is that one, we need to decarcerate our prisons, and we need to end pretrial incarceration. And what we need to do is transfer that over to actually investing and lifting up people. If the crisis can be seen as anything, it can be seen as an example of our sort of policy failures that have actually not kept anybody safe in a real material way, but also the policy failures that are racist and locking people up and forcing them in congregate facilities. I think it's something where the best way I can put this is we already know how bad prisons are. We already know how bad jails are. And what this crisis can show to people is that they're so bad and so dangerous that it will get people killed. And so we have to act now because we failed to act in the past. And then what we need to do is, as people come out, we need to make sure that we lift them up. I always think of prisons and jails as a response because we've decided to disinvest in communities most needed. And so instead of the state looking out for people when it comes to housing, when it comes to healthcare, when it comes to schools, when it comes to a living wage job, the state said, we can remove you from society and lock you up and not have to think about you. And now we're in this position where we have too many people locked up in too many dangerous situations. So I think the best way to put it is we know what the problem is. We know what the solution is. And if anything this virus is doing is making it so that other people who may not have known now know how bad and dangerous this is. So.
Right, absolutely. People who are locked up inside don't have any, little to no access to health care. But that's why at the Worker Center for Racial Justice, we actually had a bill to address that. We have what we call the Safer Communities Plan, Safer Communities Act. And what it is a job program for formerly incarcerated folks, but also what's included in it is the ability to retroactively reduce sentencing guidelines so people won't be locked up for as long as they need to be. What we know is about prisons that they don't work, right? So the Department of Corrections have done little to correct. So that's why we introduced the Safer Communities Plan to not only help folks who are coming stay out of jail and keep down recidivism rates, but to provide relief for people who are spending enormous amounts of times in jail for little to no reason, right? Anybody else like to speak on prison reform in Illinois? Any Worker Center for Racial Justice member?
Yeah, Crystal here. I'm totally for the prison reform and getting, working to get shorter sentencing and just basically keeping our loved ones safe. I personally have 2 members of my family that are incarcerated. One of them, I just found out from my mother this morning that he has been sent to the infirmary. He was able to text, because they have tablets now, and let us know, like, this is what's going on with him. And, it's scary because we don't know what's going on with him. My mother and her sisters are taking financial responsibility for one of my loved ones because, he's there and, and he has to be taken care of. So, and they're on a fixed income, you see, and I was able to help, but now with this COVID, going on, I'm not able to help him. So, it's scary. My kid's father, he's also incarcerated, he'll be home. However, when he gets home, he's been gone, 16 years, a long sentence that's a whole nother story. However, it's like, is he going to have a job? Is he going to be able to find a job? Is anyone going to give him a chance? So that's why I stand with the Worker Center for Racial Justice on these issues, because I know how they affect you, and I would never want anyone, I want in the future for, someone not to be affected like this, because it's a chain reaction, it's more than on the surface.
Thanks, Crystal. What you see now shared on your screen is the Worker Center for Racial Justice policy demands regarding prison reform. What you see now is our bill regarding extended terms. A lot of people are spending crazy amounts of time incarcerated simply because there was that second offense. When you already have that ability to sentence within the current sentencing structure. Extended terms basically only affect Black people. And at the Workers Center for Racial Justice, we want to get rid of it. Our prisons are overpopulated, and the way to stop that is by releasing folks who shouldn't be there. They're served their time. If folks haven't been reformed in 20 years, then we have to find out another solution, because locking people up and throwing away the key it's not working, and it's not helping. What you see on your screen right now is our justice reform demands. Number one is undertaking emergency decarceration measures to reduce the spread of coronavirus in Illinois prisons. 2, support immediate and long-term stability of individuals who are released from incarceration. And 3, implement immediate measures to protect the health and human rights of individuals who remain behind bars during this pandemic. So that's not only releasing the people who can and needs to be released, but the people who are unable to be released, get them adequate protection, adequate PPE, adequate healthcare services. There are mothers, fathers, brothers, sisters. Those are people behind those bars, and they need to be taken care of. We're going to move on to a bit about workers' rights. So Black workers are already experiencing higher rates of job loss because of coronavirus shutdowns and economic recession. In April, the Black unemployment rate doubled, reaching 16.7%. What workers' rights will be beneficial to you during this time? And this is for anybody employed.
Hello?
Yep.
So I'd like to share a story. Someone I know, she became an employee at an hospital. I'm not for certain of phlebotomist or some type of position at not the hospital. Her daughter contracted coronavirus, and she informed the hospital because she has someone in her home with coronavirus. She won't be, she can't attend, or she cannot return to work. The HR director informed her, if you don't come back to work immediately, you will be terminated. Luckily, she has a law background and hurry up and pursued a OSHA complaint. Just before that, she was diagnosed with coronavirus or COVID-19, and the HR director received the OSHA complaint at that. They quickly backpedaled from their original position. I believe that this story is not well, let me say this. This story is common in our communities. We're often told that we have to go back to work, be at work, regardless of what's going on. And many of us, my mother, she was going to work at UPS for those period of times without PPE and so forth. So the demands that's placed on Black workers, simply because the jobs that we perform or that's available to us seems to have a level of abuse to it. And we take a lot more on the job than many other groups. And that goes for brown people too. If we look at the situation that occurred with Amazon warehouse, and it was just, Amazon was aware, and they told their employees to return to work anyway or be at work anyway. So these are things that low wage or middle class Black workers experience. Majority of the deaths that our community has experienced from COVID-19 has been frontline workers, what we call essential workers, people that just cannot afford to miss a bill. It's just not within their ability to do so. And these are the people, the primary breadwinners. So I would like to say one of the demands that I think we should talk about is legislation that that supports the families of people that lost their lives of COVID-19. Families have lost their primary breadwinners. And no one, the children are often still small or ready to go to college. And who's gonna, and they lost the one person that can provide and take care of them and help them through tough times, or just buy them new school clothes. So these are something that it should be some type of stimulus, some type of support for the family, the families of those that lost their lives to COVID-19.
Hey, Jamon, you bring up a good point. I actually like that because what we see, and Crystal touched on this earlier, was that we are in agreement that the whole world was under financial, constraints, but the people who the government chose to help out is big business. So this next question is posed to the representatives again. What can be, because most people who needed supplemental income, who had that side job, that side hustle to make ends meet from their 9 to 5, most of those people lost the 9 to 5 or lost their side hustle. What can be done on the state level, seeing that most folks are not eligible for the PPP loan?
So the question was, what can the state legislature do to?
Yeah, what can be done on the state level for folks to supplement their income, since we only received one stimulus check in the month of March, and most people were ineligible for a PPP loan?
Yeah, so the unfortunate part about that is, just like people have individually been waiting for, a stimulus or a shot in the arm from the federal government, so has the state government, right? We don't know what the budget looks like for the state government, because we do not know, what the feds are kicking in. But I know there have been a bunch of conversations with the Illinois Department of Employment Security, which is obviously one of the agencies that has been utilized the most in this during this COVID pandemic, and folks like that to try to create some kind of grant programs, loan programs, things that can supplement for the people who are unemployed. There is no perfect answer right now, because obviously we've talked about this in the beginning. We were not, and this is me talking, I'm not speaking for anybody else, we were not prepared, right? We were ill prepared, and therefore we're trying to catch up on a lot of this stuff. But I think that we have to find ways to be able to step in where the federal government has lacked, because that's our job as a state government. I don't know if any of my colleagues want to jump in if they have anything to add to that, but that is a difficult situation to maneuver.
I'm going to pose a follow-up question, because we're talking about work and essential workers. And what we see over the last few months was that, most Black people are essential workers. Not only with this economy built on our backs, but we are important to keeping the economy moving. We heard the word essential worker thrown around a lot. And I have a theory that people are more sacrificial than anything. People who are forced to work because of the conditions they're in, don't have an opportunity to quit, don't have a savings account lined up, and can't afford to lose their job because there's been no freeze on mortgages or anything like that. I'm going to ask, how can essential Black workers leverage this historic moment to force employers and lawmakers to protect their basic rights, short-term and long-term? And this question is for anyone.
This is State Representative Camille Lilly. And I do have a piece of legislation. It's called, it's basically a racial impact bill. we have historically, decade after decade, make laws that are affecting the essential worker, if you will, that adversely affect the Black community. We have to stop doing that. We have to stop making legislation that's putting us in jail, that's putting barriers in place for access to jobs and access to health care. And every single bill in the General Assembly would have to go through this test, muster the test that it would not create a racial impact or discrimination or cause harm to another or to any citizen in Illinois. We don't have that. There's 2 other states has the racial impact bill, Massachusetts and Wisconsin. And basically it's putting us on notice as lawmakers that we're part of the problem. So that's one bill, or that's one piece that can address the essential worker. And what we need is from young people like yourself or the center here to galvanize behind that type of legislation and support it. And be a part of the advocacy that makes the state do what they're supposed to be doing. Historically, and I've been in the General Assembly 10 years now, but prior to that, we're needing the citizens to organize, to come and be a part of the solution. We legislate, we're elected to put forth the wishes of the people, but when we are out there pushing legislation, we don't have as many people organized around our issues.
I understand you, Representative.
We got many of the pieces of legislation come from groups or come from individuals, but we need to have like the center to join us in the advocacy to get it to the end zone.
That's a great point you brought up about community advocacy. And I understand that bill that you're referring to, and we at the Workers Center for Racial Justice have championed that bill through our policy guide. You know, every year we release a policy guide of policy solutions that people have introduced or that we want to see introduced that will be helpful for Black folks. So we appreciate that, and we look forward to continuing to fight with you on that bill.
Thank you, and whatever we can do as legislators to get you to Springfield, because you need to be seen and you need to be heard.
Absolutely. We are getting a lot of great questions coming in online. We're going to try to answer them. Some of them will be saved for the question and answer portion, though. So when it comes to bills that are exclusive for Black folks, because we are so often left behind, and I'm posing this to our Workers Center for Racial Justice members, both here and who are attendees who are not on the screen, what type of legislation would be helpful for you to see your life made better by Congress, by local state reps, by the city government? Like what helps the people out? Often that point is missed when we go from all the way to the street level to the elected officials. So we want to hear from you directly.
Can I say something?
Go ahead, Miranda.
Okay. I just wanted to make sure that I could speak. Basically, I would love to see not only a one-time stimulus check, but a monthly stimulus check ongoing to really help me and my family out. Because I mean, I think that that's ridiculous. Like, this pandemic is going to go on for who knows how long. And I think that having a stimulus check that comes monthly is a little bit better than just a one-time $1,200 check. Personally, that's just one thing.
Thanks, Miranda. So some community groups have been advocating for an increase in the earned income tax credit. You know, basically the stimulus, the tax credits and the tax checks that we receive from the federal government at the beginning of the year when we file for the refund checks. Basically a smaller one on the state level that can carry us throughout the year. How do any of the representatives or senators on this call feel about that? Are you supporting that legislation? And if so, what can we do to advance it?
What legislation in particular, Antonio?
The Earned Income Tax Credit legislation.
Yes. Mm-hmm.
The expansion of the EITC.
I think many of us are on that bill.
Yeah, I think so. I was gonna say that.
Yeah, I think we all are on that bill.
Yeah.
Okay.
Yeah.
That's great to hear. So if one of you would care to explain what it would do and then what we can do on the community level to help see it pushed forward.
I'm trying to pull it up right
Yeah,
now.
we have to pull up the bill to get those particular. Do you have it in front of you, Antonio?
No, I don't. No worries. We can table that question.
Okay.
Antonio, just to add to what Miranda just asked, I know that maybe it was last Friday or maybe today, but on the federal level, and I don't have all the information on that, but I know that this is something that happened. Senator Kamala Harris did file a bill recently that would create I think it's $2,000 per month kind of stimulus stipend to folks, based on the same things that Miranda talked about, that that one-time shot in the arm was not enough to sustain families.
Can I raise a question, Antonio?
Sure, go ahead, Christoph.
I just wanted to know, are there any efforts underway at the state level to stabilize housing going forward? I know that there's been an effort to not enforce evictions right now, but as this continues to kind of to go on, we don't know how long this pandemic is going to last, but we're just trying to avoid a housing crisis.
Yeah, I'll speak to this. I mean, me and State Rep Deli Ramirez introduced a bill that it's a giant package, but it in sort of a marginal way cancels rent and mortgages during and after the crisis, but would use whatever could come from any future federal money to pay that rent or that mortgage, sort of that cancellation or forbearance. Combine that with just cause evictions that would give renters, tenants, homeowners, small landlords more rights, more legal rights. So the idea is that oftentimes when we talk about housing, it's a larger landlord pitted against a small landlord, pitted against a homeowner, pitted against a renter. But in all honesty, we can create a program that would say, if you're a small landlord, you already have a relationship most likely with a renter, so let's make sure that you're protected. If you're a homeowner, let's make sure that you have mortgage forbearance so that you're protected, and let's make sure the renter's protected. Too often when it comes to housing and large landlords, they're essentially we're getting in the weeds here, but they're essentially financial institutions that are used to prop up investments none of us see. So in one way, if we're looking at sort of regulating financial investment, that's one way for us to regulate when it comes to housing.
And I'll add one more piece to what Senator Peters said. I know that there's a lot of conversation on some of the loopholes in some of the both state and city policy that allows developers to get either money or zoning changes and or land from government entities and then basically buy their way out of affordable housing requirements. We've got to take a real look at that, and I know there's been a lot of conversations about that. And then in addition to Senator Peters and Representative Ramirez's their efforts, I know that Representative Chris Tarver has been working on some legislation that would require that anyone going to eviction court in the state of Illinois would have to be provided an attorney. What we see a lot of times is that folks are going into eviction court against, as Robert said, a landlord who has means, and our the tenants are going in without any legal representation, and they're just getting steamrolled from the moment they walk into the courtroom. So there are a few states, Michigan being one of them, and I think New York was working on it last session, that require that the state provide, or that whatever the unit of government is provides it's kind of like having a public defender, right? Having an attorney for these eviction cases to give the tenants some protection.
Thank you.
And I would add, I think it was last session, we had debate around rent control, which allowed the voices of the people, meaning the renters, to look at a model, I think it's out of New York, where the rent has become a problem for citizens. You just can't afford it because of new development, because of the raising of the rent. And they had some legislation based on the area, the rent can only go so high. Of course, there was a lot of opposition to it, but we've begun the debate. You may want to look at that bill, meaning the center, to see how you can weigh in on that as well.
Thank you so much, Christoph, for that important question. And thank you, Representatives and Senator Peters as well for chiming in. As we round up, workers' rights during this time, and also ensuring that those affected by, affected by rent control and housing are protected during this time, I would love to highlight as well the workers' rights that the Center for Racial Justice has introduced and are urging that representatives take a look at as well. So some of the workers' rights demands that we have included are ensuring adequate protections to all essential workers on the front lines of this pandemic. And that includes paid sick leave, personal protection equipment, and also hazardous pay increases. And then secondly, investing in longer-term growth of high-quality jobs for Illinois workers. And that kind of includes like a statewide economic relief package for employees, and then also including 80 hours of paid sick leave. So those are some of the worker centered demands as well towards workers' rights.
Do we have a copy of this, your demands?
So it is available on our website, but after this webinar, I can also send all attendees and all representatives and senators a copy of this COVID-19 racial justice guide as well.
That'll be great. Thank you.
You're welcome.
Thank you. So these next group of questions are posed to the representatives and senators on the panel. We would like you to take, if you choose to do so, take 30 seconds to respond to some of the things that you heard on today's panel. And also saying, how are you prioritizing and committing to advancing long-term racial justice legislation, including in the coronavirus relief packages and legislation in general going forward?
I'll start. I heard from the folks on this call something that we see every day. I heard what I know to be true, just from experience, and it's hurt, right? Our communities have been marginalized, we've been ignored, we've been skipped over, and it is more evident now than ever that these, just years and years of disinvestment have resulted in where we are today. I also am reminded that there's a lot of talk about folks being eager and encouraged to get back to normal, but when we look at, our educational system, the criminal justice system, disparities in healthcare, normal is what got us here. Normal is not okay. Normal is not good enough, and we can't return to normal. We've got to do better than normal, and we've got a chance to do that by bringing everybody to the table. So I am absolutely committed to doing what needs to be done to take your concerns and your voices and bring them to Springfield so we can find ways to collaborate and make sure that we are never putting ourselves in such a disadvantaged position that we see, that we see results like we've seen during this COVID-19 pandemic.
This is Representative West from Rockford. First off, thank you for this. This webinar is very informative. The biggest takeaway that I want that I have for myself, and I hope that we all realize, is that now more than ever we must mobilize, not just as legislatures, but we need to mobilize with organizations and community leaders and members and activists to ensure that legislation that is brought to Springfield and DC is not only supported by Black Caucus members, but it's supported by all legislators down there, so that they will understand the importance of each legislation that is for our Black community.
Anyone else care to chime in?
This is Representative Lilly. What some of my takeaways are the appreciative to the center, the West Side Justice for Racial Rights Center, and its supporters and workers. Your passion and your concern for the citizens due to the COVID pandemic is heartfelt. So I want to thank you for pulling this together and putting your demands on paper. Thank you. One of my champions is healthcare. I believe if you don't have your health, you don't have much else. And I will continue down that lane to make sure that everyone has access to healthcare, from supporting legislation that creates what we call Medicaid for all, to make sure that every healthcare worker on the front line has health coverage, to make sure that the Medicaid dollars that are supposed to be for the most vulnerable populations in our communities receive those dollars so that they can have better health outcomes. I will continue to fight that fight. If you don't have your health, you don't have much else. And it's important that we make sure you have access.
Thank you for that, Representative Lilly.
Thank you. Can I say something, Antonio, to that?
Sure, Crystal, go ahead.
Thank you so much, Representative Lilly. I appreciate you for that. I just want to request, what I'm taking from this is for us to rally up and, share this with people and show up and be seen. And also in that, in that healthcare for everyone and everything, I go into the homes. So a lot of times the home care aides are just, those just are home care aides, but we are there, we're in these homes. We are getting to know, these clients, and a lot of them are elderly. It's another program, of course, Doors, where you work for all ages, but my profession, we work for the elderly. So can we, get some more help for us as well, so our clients can feel safe, and that's another thing. I had, my job was offering us to go work for COVID patients that were in their home. And I called, they said that it was a way, you could work for them, you get paid more. I called my supervisor. I told her, hey, look, and I have an 8-month-old baby, but I told, I called her godparents and I'm like, hey, I'm gonna need you to keep the baby for a couple of months because I know my community of elders suffering with COVID aren't getting any service. And I know I'm only one person and I want to work. And I told my supervisor, and no one has gotten back to me yet on that, because they had to send my information somewhere else. It's a, I guess the federal government. But anyway, long story short, I haven't gotten any response to that. So I don't know.
Can you please forward me that information? I can follow up on that for you. And you're absolutely right. The work that you do is very, very vital to the most vulnerable populations in our state. And the worker has to be supported to support that population. Yeah. Otherwise, we have we're weakening two sets of economics, right? Yeah. So I do believe that all of the workers in Doors and CCP and all of those should have health coverage. And if they don't, my strength and my prayer is that you get it.
Okay. Thank you. Thank you for your support.
You're welcome.
Thank you.
Just let me know so I can follow up.
Okay, now in the interest of time, we want to move on to some of the questions that we are receiving via the chat inbox. So this is a great question. Will there be property tax relief during this pandemic?
I hope so, but probably not. I'm being real with you guys. I would definitely hope so. But I think a lot of the things that were on the docket to get addressed in this session, obviously we have not been in Springfield since March 5th. We have no idea when we're going to go back. I assume that we will go back at some point, right? I'm hoping that we will pass a budget. But I don't have great optimism that some of the stuff that I think is most important when it comes to what we were going to do this year or even look at this year is going to be addressed. I don't know if any of my colleagues want to jump in, but I just, that is, once again, I'm not speaking for anybody else but myself, but my thought is that we won't get to that this year.
Representative Buckner is correct. For this session, we're going back to deal with the most urgent matters of the state. I do believe property tax will be on the horizons to be further discussed, merely because of the 7.5 million unemployed persons in the state of Illinois. So it's not too far off the horizon, but as far as this session, it probably won't come up.
Thank you. Appreciate the response. This next question is about the homeless population. A lot of our people who are not thought of when it comes to being most endangered are the homeless population, who no longer have a library to go into, who no longer have a Subway or McDonald's to sit down there to get warm, and who just lost, and who's sometimes mentally ill so much that they probably wouldn't access this stimulus package or any other things that are coming forward. What can we do to help out our homeless population?
There is an advocacy group that is already working in this area. I believe it's called Safe Haven and a couple other ones. What I am and we are all listening to the needs of the homeless. And we're working also with the city of Chicago, trying to create a fund for the homeless. I believe in the Senate. I don't know which senator is carrying it forward, but I do know Representative Ford is bringing it forth, and then Representative Delia is talking about it a lot as well. So what I like to do is look at their legislation and talk to those advocacy groups to see what we as legislators need to support for this particular session.
Thank you. So now this is a question from me, representing the Workers Center for Racial Justice. Meaning that we are not in you guys are not in Springfield right now, and we are lost when it comes to like what's going on down there. How can we help? How can we assist? Because we released our COVID-19 policy guide. We release guides at the beginning of every year to help out Black folks and every folk in general. What can we do remotely since nobody's in Springfield?
I think this is a good step, Antonio.
I'm sorry, I can't hear you, Representative Buckner. I think your audio went out. Can anyone hear Representative Buckner?
No, I can't hear him either.
Okay.
No.
Can you hear me now?
Yeah,
we
we
hear
can.
you now.
Okay, I don't know who else has Xfinity, but my Xfinity is trash. But I think the part of the reason that we're doing this today is because we don't want to be blindsided. We don't want to go back in Springfield and say, well, we know we got to do something, but we haven't had intentional and collective conversations with groups in our community about what's important to them. Once again, this is a really awkward time because we don't know. We have no idea when we're going back. We have no idea what the cadence of the session is going to look like, and what we will actually be able to get done. But I think it's important to continue to engage us, to engage not just the reps who represent you, but all of us, right? So we represent certain districts, but we legislate for the entire state. And I think I speak for my colleagues by saying just by virtue of us being members of the Black community that we are concerned with the plights of the community all around the state, from up in Rockford where Representative West is to down in the Metro East, East St. Louis and Champaign and Peoria and all those other places, right? So we all are kind of in this together. We've got to have these conversations. We've got to continue to push, and I would say that the onus is on groups like the Worker Center for Racial Justice to keep us abreast of what's happening, keep us abreast of their thoughts, their ideas. This is a fast-moving pandemic. This is a fast-moving crisis, and we can only get a hold of it by continuing to have conversation back and forth.
Thank you.
Ditto.
You have a great point. It's up for community groups like the Worker Center for Racial Justice to bring those views from the community to the legislators. So that brings us to our what might be our last question before I pass it off to our colleague Joy. Do you agree to help promote these racial justice policies once Springfield resumes?
Yeah, so I'll start this off too. I am, and I know my colleagues are completely committed to doing what we can from a policy standpoint to make sure that we are effectuating some change. Obviously, on the legislative side, there's a process that's involved, and it involves us being able to build coalitions with other folks, not just the Black Caucus, but with other members of the Democratic Caucus and other members of the General Assembly. I've seen the policy demands that you guys have. I am on board with them. I know other folks on the phone may not have actually seen the policy in writing, but I would assume that in theory that they're all on board with those things as well. But this goes back to what I just said in the last question. Let's continue to work with each other and kind of have a symbiosis and link, leverage, and align our resources to make sure that the things that are important to you guys, that we can turn into actionable policy that can effectuate change for all of us. So yes.
And I'll chime in, and Antonio, Joy, you guys know I go back with you all before I was a state senator, and we were working to change the world as organizers, and I think that work still continues. So of course, when it comes to fighting for this policy agenda, I'll be an organizer in Springfield, just like I was an organizer before I got here. So yes.
This is Representative West. The first thought that came to my mind is that's like asking us if Michael Jordan's head is bald. Like, of course, we got you. I just, so yeah, 100% we have your support. I just want to make sure, and Representative Buckner touched on it a little bit. It's just my hope that when we are doing these and working on these initiatives, we can just make sure it's statewide and not just Chicago-based. I love Chicago, but as you know, I'm from Rockford, and my priorities have to be Rockford as well. So we can just ensure that not just what you guys are doing, but other organizations who may be on the line. It has to be a statewide initiative, not just focused on Chicago.
And can I piggyback and highlight that? That is so important. One thing that I've learned in my last 18 months on this job is that a lot of the regionalization and the splintering in our community, it makes us a lot weaker. We know how we fight in Chicago, right? We got the West Side and the South Side, and You know, it's more than 290 versus 94 and Heroes versus Uncle Remus. It's like, you know, it creates a situation where we're not working together. And through my friendship and my partnership with folks like Representative West, it's become more clear to me than ever that we've got to coalesce as a community, because the plight of the folks in Rockford are the same as the plight of the folks in Brownsville right out here outside of my window. But often we don't talk to each other, and we've got to do that.
And of course, I'm a yes. I'm just encouraging the center to galvanize the people, your partners, and support the legislator as we move the agenda forward. It is so important that you are seen and you are heard on the front of the battlefield, which is in Springfield as well. So I am a yes, and I'm looking forward to working alongside you and getting the demands addressed.
Thank you, Representative Lilly.
May I say something really quick, Antonio?
All right, 30 seconds.
Okay, I just want to say, going back, you said with Senator West was talking about expanding it. I'm also a member of a organization called National Black Club University. National Black Club University, and they've broken down every community from not just Chicago, Atlanta, everywhere. Every community has a district and a village number. I am a proud district leader of District 14 that's here in West Inglewood, so it'll be good to link with them. You know, National Black Club University. And if you want to go, his name is Cy Smith on Facebook, and he will give you your village number and who your district leader is. And as district leaders, we give out different resources. And of course, I always resource, you know, Workers Center for Racial Justice and other things that I find out.
Thank you. I appreciate that, Crystal. But yeah, it is very clear that it's very clear who's like on our side in these battles for justice. Thank you all for being here. But lastly, what I want to say is a lot of our questions were like, how can I get involved? Who can help? How do I sign up? If you noticed that Joy put something in the chat, but I'm going to pass it to her so she can explain to you what we can do as community members to continue to push our legislators and help them while they're in Springfield by supporting positive legislation.
Thank you so much, Antonio. And thank you all Workers Center for Racial Justice members, state reps and senators also for joining this call and participating, and also just committing to advancing racial justice legislation. So we have a lot of ways you can get involved right now. I put it in the chat, but after we finish the webinar today, everybody's going to receive an email of all of this information. And so we do something at the Workers Center for Racial Justice called action alerts, where basically you can send agenda issue areas, demands and things like that to legislators and elected officials to really keep them engaged during this time. And so we have a 3-step action alert that we are now circulating. And it really focuses on our Workers Center for Racial Justice COVID-19 response agenda. It also focuses on decarceration. And then we have a last action alert that highlights the economic justice demands that we put forth. As we were on the webinar, we heard a lot of important additions to legislation that we should also be thinking about, including healthcare coverage, renters' rights, and then also additional assistance to families who have died during this pandemic, especially people who were breadwinners for the family. And so included in this email, we'll have a link for people to add feedback. So if you think that there's other important racial justice policies that were not included or mentioned today, we encourage you to also put your feedback on there. So the Workers Center for Racial Justice, we've been around since 2012. We organize around, unemployment rights, eliminating mass incarceration, police accountability, really to achieve racial justice and equity in Illinois. And so if anybody is interested in joining into our membership, you can actually go to our webpage, www.centerforracialjustice.org, and you'll find a link where you can learn how to get involved through there. And we'll also include that in the email as well.
So thank you all for being here today. I'm glad that we can get the word out there. What you heard today was testimonies and highlights from all of our members, letting policymakers know that we know the solutions that need to happen to move our people forward. I want to send a special thanks to all of our members: Crystal, Miranda, Denzel, Christoph, Jermont, who had to hop off. But this work couldn't be done without you guys. And we are a membership-based organization. And be sure to respond to the emails, and we are logging off.
Thank you all so much.
Thanks, everybody. Have a good night.
Have a good one.